Good morning, guys. So today I wanted to show you guys how to prepare your IVF meds. So the IVF meds that I've been using are Cetrotide and Gonal F. So it's currently the morning, so we're going to start with the Cetrotide. Cetrotide has to be done sometime in the morning before 9 a.m. So that's why it's early and I'm saying good morning. So the Cetrotide comes in a box like this. It tells you everything it has on it. So let's go ahead and open that up. So when you open up the package, this is what it looks like. You have your powder, your syringe, 2 needles, and it comes with 2 alcohol swabs. You're also going to need your sharps container, a gauze pad, and a Band-Aid if you're a bleeder. Alright, so what we're going to do is open this up. So I've already washed my hands. You're going to want to make sure your hands are washed. And this is the needle. It comes with fluid in it. So the first thing we're going to do is take the little vial of powder, if you can get it out. There you go. You're going to pop the top off, just like that. You're going to take an alcohol swab and clean the top of it. So anything that the needle is going to go in needs to be sanitized. So the needle's going to go in that, so we're going to sanitize it. So it comes with a small needle and it comes with a bigger needle. So obviously the bigger needle is to drop the meds, the smaller one is to put into you, to administer. So we're going to go ahead and put the bigger needle on here. So this is what the tip of it looks like. We're just going to screw this needle in. Make sure it's nice and tight. We're going to pull the tip of it off. There's an air bubble in there. I don't know if you can see it. We're going to click it so all the air goes to the top. And then I use the counter to do this. So I just place the syringe on the counter. And I'll press down until I see that all the air is out. So until you see a couple drips come out of the syringe. And I just do it slowly so that I don't waste any. There we go. So we got a couple drips. So now we're going to take our vial. We're going to poke the top of this. And then we're going to push all the meds in. Make sure we got them all in there. And then you could just shake it around a little bit. Just do like circular motions. Don't really shake it, but swirl it around, I guess I should say. And it looks like it's pretty clear already, like all the powder dissolved. So now we're going to draw it back up. So I never pulled the needle out of here, the syringe. And I don't use the syringe to stir it. I just kind of swirled it. So now I'm going to flip it upside down. And there's a little window in the vial. I don't know if you could see that. You're going to want to pull your needle all the way down in that little window. So almost so it's out of the vial, but it's not. So I just look in that little window and pull the needle down as far as I can without it coming out. And then I slowly pull the meds back in. You want to make sure you get all the meds. So that's why you want to make sure your needle is low so that you can get all the meds out of that vial. And I'll just keep pulling until... Okay. And then I always flip the vial to make sure everything's out. Everything is out of there. So we're done with that. And now there's air in my syringe. So before I get that out, I'm going to change needles. So this one will go in your sharps container. Put the top back on, unscrew it, put it in your sharps container. Grab your little needle, screw it on, make sure it's nice and tight. Take the top off. Again, I'm going to use the table. I'm going to press down slowly, get all the air out. So you're going to want to see a couple drops come out of the top. There we go, a couple drops. So this needle is ready to go. So I'm going to just put the top back on it. And I'll show you guys me putting it in. So you're going to want to take another alcohol swab, clean where you're going to do it. So yesterday I did it on this side, so I'm just going to rotate sides. And we'll do it over here. Let me get my gauze ready. Alright, so now I'm going to take the syringe, there's the needle size. I'm going to pucker up my skin and direct straight in. And then we're going to slowly push the meds in. My skin is still puckered up. And then we're going to count 1, 2, 3, 4, 5. Release your skin. Pull out the syringe. And then I always put the cap back on it right away. Grab your gauze. And I apply a little pressure and I do circular motions just to kind of spread the medicine around, I guess. Make sure it's in there. And this one's not really bleeding. And then of course you're going to want to take the syringe, screw the top of the needle off, and drop that into your sharps container. And that, my friends, is how you prepare Cetrotide. Hi guys! So now it's time for the Gonal F. It is 8 o'clock at night, so Gonal F I was told to take mine 5 p.m. to bedtime, so I'm taking it at 8. I try to take it around 8 o'clock every night, and same with the Cetrotide. I will try to take that around 8 a.m. in the morning. So for Gonal F, you're going to need your sharps container, a gauze pad, 2 alcohol swabs, which unlike the Cetrotide, the Gonal F does not come with alcohol swabs, and your Gonal F pen or box. So the box, this is what the box looks like that it comes in. And then when you open it and take out your pen, you got your pen and your needles. Ooh. So both Gonal F and Cetrotide have to be refrigerated, not frozen, refrigerated. My dose is 200 units. Gonal F is like so easy to use. So you take out your pen, and of course I washed my hands first. You're gonna pull the cap off, and I always dial mine up first, so you're just gonna turn this away from you. So the tip of the pen you just turn away from you until you get to 200. So even if you don't have 200 units left or whatever your dose is in the pen, you're still going to dial it up to what your dose is. And then when you administer it, it'll do what's left and whatever number is left in your window. So let me show you the window. so you could see the 200 in that little window right there. So when you administer it, if there's not 200 units left, then it'll tell you, like the one time I had 50 units left in the window. So then I just opened a new box, took a new pen out, and dialed it up to 50. So that's how you do that. So the first thing you're going to want to do, there's like a little ball at the top of the pen. You're going to just clean that with an alcohol swab. You kind of got to stick your finger in there to get it clean. And then we're going to open up our needle. We're just going to screw that right on the top. And you're ready to go. So, Gonal F is really easy. So I'm going to get my gauze pad ready. I'll step back so you guys can watch me do this. Take my alcohol swab. So this morning I did Cetrotide on this side, so I'm just going to go ahead and do Gonal F over here. I'm going to pull this little blue cap off, show you how big the needle is, not that big at all. You're going to put your thumb on the top of the thing so you could just put it in and administer it right away. So we're just going to go ahead and stick that in. Press down, and then 1, 2, 3, 4, 5. Release, and pull this out. And then I'm going to take my gauze, and I'll go ahead and put the cap back on my needle, and I'll set that down for a second and just kind of massage this into my belly. And I'm not really a bleeder. I never need Band-Aids. You might need a Band-Aid. I don't use Band-Aids. Okay, so then I just take the top of this, put it back on, unscrew that, and drop that into your sharps container. And then the pen I'll put back in here. I still have some left at the bottom. So that has to go back in the refrigerator. So this I'll just box back up and put it in the refrigerator. And that's all for the Gonal F, guys. Hope you had a good night.